Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
When you or a loved one is given a diagnosis of cancer, the last thing on your mind is probably how much it's all going to cost. A recent research study at Mayo Clinic reviewed more than 500 recorded conversations between physicians and their patients. And here's what they found. Fewer than 1/3 of these discussions talked about the cost of cancer care. Now, just as troubling, when patients did raise the questions of cost, like, doctor, do you have any idea how much this treatment might cost? Only 60% of the time did the doctors in this study seem to acknowledge that it could indeed be a problem for the patient and the family.
You probably didn't know either.
No, they probably didn't.
Since cancer patients are 3 times more likely to declare bankruptcy than people with other chronic ailments, conversations about cost are important. Here to discuss financial toxicity of cancer care is Mayo Clinic internist and researcher Dr. Rahma Warsame. Welcome to the program, Dr. Warsame.
Dr. Warsame,
yes.
So good to have you on the program. So getting cancer anywhere in the world, I guess, but particularly in the United States, can be a costly proposition, can it?
Significantly, yes. So it's expensive from the very beginning, from the diagnosis and consultation, all the way throughout until hospice or end of care.
Just the term financial toxicity of cancer care is kind of a loaded phrase on its own.
It is. It was really coined in the last 5 to 10 years. It's the economic burden in which patients face as a result of their diagnosis, and really encompasses everything: job loss, medication copays, chemotherapy, treatments, as well as surgeries, radiation, consultations, and then for their family members as well, who often have to take time off or need to support them financially.
I know there's all different kinds of cancers, and they're treated in all different sorts of ways, but is there, can you give us a general idea of how much money it takes on average to care for a patient who gets a new cancer diagnosis? Is there a figure out there like that?
I don't think so. It's so varied.
Sure.
For each patient and for each cancer, the biology, what you'll end up doing and what they'll end up requiring or responding to, that I don't think that there is a figure out there. It would be nice to have one, to quote. You can get figures for like how much each treatment would cost, or what the estimated, I do stem cell transplants, what that would cost, but not really overall.
We were talking as we did the introduction, and Dr. Shives said not 60% of doctors don't acknowledge that. And I said, probably because they don't know either. Do most physicians know how much a cancer treatment costs?
No.
Yeah.
No,
wow.
not at all. It's difficult because you could give the same therapy to 2 people and it could cost wildly different costs because of insurance differences and supplementals and contracts between. It's so complex that frequently you don't know.
Do you think physicians should know?
I do think that we should know a better idea as the person prescribing all of these treatments, or and the cost helping to incur it. We should get a better idea of what our patients may face.
Well, but as your cancer treatment goes along, for instance, if it takes a year for your cancer treatment, there's so many variables that can change in there. I can see how you wouldn't want to say, yeah, it's going to end up costing you $110,000, and then it ends up quadrupling that.
I agree. I don't think there's an exact number you need to quote. I just think that it needs to be acknowledged and discussed that this may be costly and that we need to redress this if you find that insurance won't be covering that, or if challenges you face change with your family member. I think addressing and acknowledging that there will be a costly portion of this is necessary.
But don't new cancer patients and their families, aren't they often referred to a social worker or the business office, so that if they do need help covering some of the costs of the treatment, that we would help them? At least that happens here, doesn't it?
It does happen here frequently, but not nearly enough. I think that it should be mandatory for a new diagnosis to have a social worker assessment, or even more so, a financial navigator kind of assigned to cancer care, because it's so specific, because our social workers cover the entire clinic, and when you have cancer, it's a different animal.
What are some misconceptions that cancer patients have about the financial part of being diagnosed with cancer? Any that you can think of?
Frequently, even when you do bring it up, a lot of patients will, it doesn't matter. Like you're trying to put a cost on my life, and this is life or death, and I will figure it out. I don't care is a frequent issue. And not often do they think it's going to be cheap. That does not seem to cross their mind.
Obviously, there's a lot of things to think about that don't have anything to do with finances when you get this diagnosis of cancer. And so maybe the first visit isn't the best one to talk about it. But what do you suggest to patients who are newly diagnosed? What questions should they ask?
I would ask what I anticipate the duration of this treatment to be, and if there are any unexpected costs or copays that we're aware of, that things that may or may not be covered. How much time off work do we anticipate? Could I work? Those are key questions that can make a significant difference on whether or not they can maintain A, their insurance, and B, whether they can have a continued income during this process, because that's important to know how much time off you or your loved ones will need.
Because a lot of these times you cannot go to your cancer appointments by yourself. Sometimes you have to have somebody with you.
Definitely for a transplant, you'll have to have someone with you, but frequently you need someone with you. It's so much information that a second pair of ears is necessary.
Well, even like going through chemotherapy, I'm sure it's changed, but when I went through chemotherapy, I could not have done that by myself. I actually needed someone there to walk me out of the hospital. It does affect more than just the cancer patient, that's for sure.
So, Dr. Warsame, I just want to ask you, when you say that physicians ought to be better informed about the cost of treatment of the patients that do have cancer, you're not suggesting, are you, that if physicians knew things might change or the type of treatment that they would recommend? That probably wouldn't all change. It's just because it's a good idea for the physician to have in mind some numbers that they can give to the patient so the patient and their family know, correct?
Yes, although sometimes you could change it. Sometimes there are equally efficacious things or...
Well, why wouldn't you always use the cheapest one?
Well, sometimes the difference is small, and that small difference of clinical benefit or statistical significance was enough. But I think it's worth telling people that these two regimens, this one had this much more clinical benefit, but costs a whole lot more. Even if you don't change your therapy, if people are more aware, you can identify sometimes people who are more likely to not be able to afford the therapy and preempt the situation beforehand.
All right. Well, it's great to have you on the program. I think you're exactly right on when it comes to physicians knowing a little bit more about how much this is going to cost their patients, no matter what the diagnosis, but particularly true when it comes to cancer. Dr. Warsame is an oncologist and hematologist as well as a researcher at Mayo Clinic. We've been talking about the financial toxicity of cancer care. Dr. Rahma Warsame, thanks so much for being with us.
Thank you again.